Mark has been a member of the Labor Party in the federal parliament since 2007 and is the Shadow Minister for Health and Ageing. Mark served as the Minister for Ageing and Australia's first Minister for Mental Health in the Gillard government. He has also held the ministries of Housing, Homelessness, Social Inclusion, Climate Change, Water and the Environment. Before Mark was elected to Parliament, he worked for some of the most disadvantaged people in the community as an official with United Voice for over 15 years, including 11 years as State Secretary. In 2003, he was awarded the Centenary Medal for services to trade unionism. In 2013, Mark was awarded the Alzheimer's Disease International Award for outstanding global contribution to the fight against dementia. Mark is also a published author and holds a first-class honours law degree. And he's currently the member for Hindmarsh, and we are very fortunate to have him with us today. Welcome, Mark.
Well, thank you, Monica, for that introduction, and for the speakers in the previous panel. I was able to catch the last 10 minutes or so of that fascinating discussion. I might have some remarks to make about a couple of those issues myself. I'm coming to you from Ghana land, which we now call Adelaide, and I want to pay my respects first of all to elders past, present and emerging, not only in these lands, but lands all around the country that you are all coming from. I'm delighted to spend some time with you at this conference. I'm in the middle of a short period of paternity leave after welcoming a new baby over the last couple of weeks, so you'll excuse me for being a little sleep deprived, and hopefully take some mercy on me with very gentle probing questions in the Q&A session if we have some time for that. But at the outset, I want to congratulate you all for putting together this conference again. I know this is a conference that has been happening for a couple of years, and it is an extraordinarily important one. I'm a very strong believer in the importance of a patient voice, or in some sectors we describe as a consumer voice, in the development and the delivery of good policy from Canberra. It's something that I've tried to keep an eye on right through my parliamentary career, and particularly in my ministerial career. We in Australia, as so many other countries around the world, have come a long way, even in my lifetime, in the delivery of healthcare, in making sure that there's a much stronger patient voice at the centre. As I said, not only of the development of policy, but in the delivery of healthcare as well. I was reading in the very, very early hours of this morning a piece in The Economist magazine about clinical trial development in the UK at the moment. They described the old traditional form of healthcare as eminence-based care rather than evidence-based care. The idea in the olden days, not too olden days, really frankly, that we as patients did and took whatever our doctor told us to. And we have come a long way from that. We are a healthcare system that focuses much more on evidence than on eminence. And I am glad to say have a strong patient voice in the development and the delivery of healthcare policy. But there's no question that there are still some very big gaps. And I know that your conference and your organisations are focused on a day-to-day basis on trying to close some of those gaps. And they are gaps that exist in a range of areas, but including in areas that I've worked in for many, many years, such as mental health and in aged care, particularly areas of ageing where the population is increasingly impacted by cognitive impairment, which obviously makes patient decision-making more challenging than it might be more generally in the community. Your conference is also really timely because yesterday we commemorated Rare Diseases Day, and I know that so many of your organisations focus on rare diseases, which we know in an aggregate sense at least aren't really rare at all. There are as many as 2 million Australians who are impacted by 7,000 diseases that we describe as rare diseases, and that number is increasing, not every day perhaps, but very, very regularly as we live through this turbocharged period of discovery with extraordinary advances in genomics, in big data, in diagnostics, in healthcare, meaning that we are discovering very regularly new diseases which join that category, if you like, of rare diseases. But as you know better than me, some of those perennial challenges in Australia's healthcare system around timely diagnosis, around system navigation, around care coordination are even more accentuated in areas of rare disease than they are in more generally in the community. I've been working with Rare Voices in my time back in the healthcare portfolio, which has been about the last 12 months. Their action plan, which I know a number of your groups would have contributed to, is a really valuable document. It focuses obviously on timely diagnosis, it focuses on care and support, and it focuses as well on the importance to ensure there's a good research and data collection effort in areas of rare disease as well. Their action plan is something that I'm hoping to continue to partner with Rare Voices and other groups on over the coming months and years. I also want to note, though, before I come to my more general remarks, that the last session has been focused on women in health as patients, but I know also women in health as deliverers of care, and particularly healthcare. I've always been conscious in my time in the health portfolio over many years that although we enjoy a universal entitlement to healthcare in Australia with a great Medicare system, one of the best medicine systems in the world, and good universal public hospital systems, but a universal entitlement does not automatically translate into universal or equitable access. We in Australia still have too many fault lines in the delivery of healthcare, in access to healthcare, which we know in a very familiar way are fault lines that focus on socioeconomic difference, on geographical diversity, and on gender, as many of your speakers say. I heard Dr. Yap say, for example, that we know that women experience a much later diagnosis in many, many conditions, as many as 700 conditions, I think, what we know on an evidence base, including some very high prevalence conditions like heart attacks, like autism, and many, many others. This is something that I'm working very closely with my Assistant Shadow Minister, Jed Carney, who will probably be known to many of you, as we think about a women's health policy that tries to close that gap, that gender-based gap we know exists in the delivery of healthcare in Australia. Now, I've also been asked to make some remarks, and I think you might have heard from a couple of my parliamentary colleagues over the last couple of days about how patient organisations, I guess, can be as effective as possible in impacting policy and decision-making in Canberra. So I thought I'd make a couple of points about that before I move to make some other remarks. The first is, I think it's really important to recognise that Canberra is a very competitive field. There are more worthy, important causes that are advocated in Canberra, frankly, than there is bandwidth. There are more worthy, important causes than there are dollars in the federal budget. So even though I know advocates recognise and think that their cause is worthy and should be taken up as a matter of course by decision makers in Canberra, I think you need to go into that process recognising that these things are taking place on a very competitive field, a tightly congested field. Back in 2010, when I'd just been appointed as the Minister for Ageing, I remember sitting down with the heads of Alzheimer's Australia, as it was called then, who were in very good faith, complaining about their lack of ability to get real traction in Canberra around some very clearly recognised deficits in the delivery of good supports for people living with dementia and their families. And I had to say to the head of Alzheimer's Australia at the time that one of the issues was no one was banging down my door or even lining outside my office as MPs on both sides of politics, wanting to talk to me about the deficits in dementia care that they were experiencing in their community. Lots of people at the time were banging down my door, literally, almost, about mental health supports in the community, but no one was really talking about dementia at the time, in spite of the fact that I think if we thought about it for very long, we all knew that there were some very serious deficits. And to their credit, Alzheimer's Australia, as it was called then, now Dementia Australia, took that away and put together an incredibly effective campaign called Fight Dementia that was a good air war, as we described, so able to talk to the Treasurer, to talk to health ministers, senior people, big decision makers in the government about what they needed from upcoming budgets, but also to mobilise a ground war that meant that they had families, they had patients talking to local MPs in their community about why there was such a driving need for better dementia care in Australia. They had a big rally, not that you have to have a rally, but they had a big rally out the front of Parliament House, which Butler, who was the chair of Dementia Australia at the time, addressed in what she admitted was the first time she had ever been to a rally in her long contributing life to public debate in Australia. And it made a real impact. Suddenly I did have local MPs on both sides of politics wanting to come and see me about the deficit in dementia care. And it meant that we were able to put together a really strong package in, I think, the 2012 budget, might have been the 2011 budget, that really changed the way in which dementia care was being delivered, something that was very much co-authored by government with patient groups like Dementia Australia. So recognising that even though you have a worthy cause, it's not necessarily on the radar of very busy people in Canberra, I think is the first point to make. The second point to make, which I sort of just made around dementia, is the importance of connecting with local MPs. There is nothing more effective, I think, than having local MPs raise a particular issue in a party room meeting, whether it's our party or the Liberal and National Party, raising issues in committee meetings of the party room, and making sure that their minister, their assistant ministers or shadow ministers know that this is something that their backbench feels very strongly about. And when going along to talk to MPs, I've always advocated, always tried to convince advocacy groups of the need to do three things. The first thing you need to do is to connect with your local MP. You need to make them feel that this is an issue in their community. You all know that. You all take patients and their families in their community to see local MPs, not just someone from Sydney or someone from Canberra, but actual people who live in their community, that make them feel that this is something that connects to them as their local community representative. The second thing I say is you really want to try to make sure that the local MP leaves that meeting having learned something they didn't know before, having educated them, not given them a 100-page report, but having taught them something that they will take away as something new that they learned today. And thirdly, inspiring them, perhaps most importantly, inspiring them to do something, to go to Canberra and make the case for your cause, to raise the issue in a committee meeting or even raise it in a party room meeting. That's how you get the lineup outside the minister or the shadow minister's doors that ensures that your cause, your issue, rises above the myriad of other very worthy, important issues that are being advocated on any given day in Canberra. The last thing I'd advise is to be punchy and be realistic. As I said, you don't want 100-page reports being delivered to an MP who might be having 10 or 12 meetings in a day. They simply won't get to read it. Your groups know that. Your groups are very good at developing punchy 1 or 2-page information pieces that really get the important parts of your message across very clearly. And the second thing is to be realistic. The worst thing from an MP's point of view is to leave a meeting around a cause that they recognise is worthy, being asked to do something they simply know they're not going to be able to deliver. It's something that's simply out of the bounds of realistic ambitions, given where we are in Canberra from time to time. So again, your groups are very good at that, very good at calibrating your ask to push the envelope in a way that makes a real difference to the people you represent, but doesn't necessarily ask MPs or ministers and shadow ministers to do something they're simply not going to be able to achieve. The patient voice in all of this, as you understand better than me, is utterly critical. It's really important that MPs, that ministers and shadow ministers hear from patients, or in some areas we describe consumers. And I think you all know just how dominant the producer voice is in Canberra across all policy areas. The consumer, the patient voice is not as loud, not as well represented in Canberra as the producer or the supplier voice is across all policies, including, in my experience, in health policy. So that patient voice is utterly critical. And you got to recognise, as certainly I recognise based on my experience, that it's not easy to shift policy from a producer focus or supplier focus to consumer focus. I know when I shifted the aged care system, initially the home care system, to consumer-directed care, so that consumers chose the manner in which their home care budget was to be deployed rather than the supplier of the home care, there was real resistance there. There were strong arguments about why that wasn't going to be the best way in which to deliver home care. The same arguments were made at the time, which was the same time we were developing the NDIS, which was always intended to be a consumer-centred system, the NDIS. The second thing I think to recognise is that there are still real gaps here. I was appalled, frankly, when I came back to the health portfolio 12 months ago, that there is still not a consumer organisation at a national level, at least, for mental health consumers. In the 2011 budget, I allocated funds for that to be set up. Might have been the 2012 budget, actually, but I set aside funds for a consumer organisation to be set up and funded by the Commonwealth Government. And 10 years later, still that organisation does not exist. There are gaps in some areas in the ageing space, particularly in ensuring that people, as I said earlier, I think, with cognitive impairment, have the ability to have that strong voice. And often that voice will be channeled through their carers or their family members who are caring for them and loving them. And the third thing to recognise, and we were grappling with this as we shifted aged care and disabilities to a consumer-centred care model, is that being patient-centred, being consumer-centred actually requires more support from Commonwealth. If you are going to put patients and their families in a position where they can make good, informed decisions, then they need more access to information. Not Dr. Google, but more access to good quality, relevant information. And I know that your organisations understand that more than anyone, because that's exactly what your organisations have been doing with patient pathways. I've studied this program. I know that this was something that you set up in partnership with Greg Hunt. He was a strong supporter of it, even suggesting the name Patient Pathways, as I understand it. It's been delivering great supports through the telehealth nurse program to ensure much better levels of care coordination and system navigation. Those, as I said, perennial challenges in Australia's healthcare system, even for people who are experiencing high prevalence conditions, let alone people who are experiencing some of those rarer diseases we talked about earlier. This is a program that's really delivered enormous value for money for taxpayers, really changed the lives and the experiences of many patients and their families. It's been evaluated twice as a very successful program, as I said, that delivers value for money. And I've closely studied the pre-budget submission that CCDR has put into government for that to be extended beyond its drop dead date at the moment, which is only several weeks away at the end of June. So Labor has decided, I'm pleased to announce, that if we are elected at the election that takes place probably in May this year, then we will adopt the case that's argued in the pre-budget submission and ensure that Patient Pathways is funded for another 3 years in the manner and to the amount that is set out in the pre-budget submission, which, as I understand it, is a little less than $2.5 million. These programs, which are a really relatively modest outlay for the Commonwealth Government, make real change and deliver really strong outcomes for patients and their families, and they should continue to be supported by the Commonwealth Government. So thank you very much for the invitation to be with you, as I said today. I'm sorry I'm coming to you from my house. It's been a lovely opportunity for me. I hope to give you a bit of a sense about my views in this area as the Shadow Minister for Health, and obviously from a Labor Party point of view, hoping to be the Minister for Health within a few months. I really look forward, whatever happens in May, to continuing or being able to continue to partner not only with the network, but with all of the many patient organisations that go up to make the network. Thank you very much.
Thank you so much, Mark. What amazing news. And thank you on behalf of the NPON network for your support. And I'm just going to call on Kate, who has done all the work to put that application together, to say thank you.
Mark, thank you so much. It's been such a journey to get to this point, and all of the nurses that work on the program are working really hard, and especially in the past 2 years. I think we talk about Zoom fatigue and the fatigue that everyone has on being online. If you can imagine what the nurses have been going through in the past 2 years, where it's not only volume of patients, but a new intensity throughout COVID. They're really tired. So this news just gives us the push we need to keep going, to keep helping the patients. We're so appreciative of your support. And it's really touching just to know that the work that we do and the work that the nurses do on the telehealth program is really valued. So thank you so much.
Thank you, Kate.
And I totally echo those thoughts. It has been so important for our patient community to have had access to people like a telehealth nurse over the last 2 years. In every day, it's made the difference between going forward, getting up and actually having a plan, and not being able to get out of bed in some cases. So thank you. Mark, if you have time, I'd just like to ask you one question on behalf of everybody. So we have a number of questions, but I'm going to kind of roll a few of them together. And you went through a very detailed list for us of practical advice about things that we should consider in the way that we should go forward. And you acknowledged that for many of us, we've been doing those things or seeking to do those things for some time. And you're exactly right. Many of our organisations have been to Canberra, knocked on doors, have been to our MPs. We have sought to have our voices heard and found ourselves against what for some of us feels like a tangible barrier, that brick wall. So I'm interested on behalf of all of us, how do we, where we have been taking those steps, how do we start pulling the bricks out of the wall? How do we start getting through that door, and even having some of these discussions which are so valuable to us?
As I said, I'm just going to be blunt. They're not easy questions to answer. It is such a busy agenda that Canberra has, particularly in the middle of a pandemic with all of the other issues that we have to confront, floods, long-term issues like climate change, and all of the rest of things that go to make up our daily lives. And I think that the thing I love about the Patient Pathways program, and the thing I love about the operation of the network, is, to be blunt about it, I hope this doesn't sound self-serving as an MP, but the more that issues can be collected and aggregated and funneled in a way, so you can bring a whole bunch of different groups together and present a single case to government, the better, frankly. So again, I'll fall back on some of my own experience. I worked a lot in aged care before I went into the Parliament, and aged care had been in screaming need of reform for many, many years, but right through the Howard government just hadn't. John Howard had tried on a number of occasions to land a big reform, but hadn't been able to do it because essentially groups within the aged care sector, consumer groups, as we describe them, providers, unions, clinicians, all had different views that they weren't able to resolve themselves. So, that different groups would go to local MPs and put different views about what the Parliament should do in an area that's obviously highly sensitive, that people are very sort of nervous about getting wrong because of how vulnerable older Australians receiving aged care, particularly in nursing homes, are. And, you know, I was part of a discussion 15, 20 years ago now to establish the National Aged Care Alliance. And what that did was it created a forum independent of government where those different groups were able to come together and thrash out their differences. And so the national plan that alliance was able to pull together wasn't absolutely everything that the aged care providers wanted, wasn't absolutely everything that the aged care unions wanted or the consumer groups wanted, but it was something they could all get behind. It was something that they recognised was the right way forward for the aged care sector. And I think the fact that they did that and gave us an interface point as the government at the time meant that we were finally able to deliver a very broadly supported aged care reform plan 10 years ago that had bedevilled government. It wasn't particularly a Labor or Liberal thing, it just had bedevilled government for many years. So I hope that doesn't sound self-serving, that I'm trying to sort of make our jobs easier, but the great thing about networks like yours is that you're able to pull together what can look to us like sort of fairly disparate causes and organisations, and instead of meeting with 20 different organisations, you can meet with a network and try to come up with a solution that suits all 20. So some of those frankly basic logistical things make the ability of everyone, both government to deliver, but also your organisations to achieve what you want. And I do go back to some of those basic lessons, I think, about how you really sort of cut through a meeting agenda that a local MP might have of 12 different meetings in a day. What at the end of the day do they remember out of that? What do they sort of think about the next day that they want to sort of take up as an issue? Because in many cases, all 12 of those meetings will be worthwhile. And just having your cause stand out a bit, I think, isn't easy, but particularly given the worthiness of the causes your organisations represent, is not that hard either. And so just keeping some of those things in the back of your mind when you go to those meetings, I think, is really important.
And I'd have to say, Mark, if you had been with us over the 2 days, you would have found that the emerging theme is one of collaborative effort and collective voice. So we will most definitely be taking your advice as a network, and we will be knocking on your door in the future. So thank you so much for joining us today and being part of our conference.
Thanks for the invitation. All the best, everyone.
And now it is my pleasure and privilege to actually close our conference, and we are a couple of minutes over time, so I am going to just summarise a couple of things that have become so clear to all of us throughout this conference, and that is the importance of that collective voice. And it's been so pleasing and exciting to hear from all of the vast diversity of groups and people that have been part of the conference that everyone is committed to that. Everyone sees the value in that, and together we can go forward. We can define what those messages are, learn from each other, and take those messages forward to government and create change, because all of us, that's what we're here for. We're here to improve the quality of life for the people that we represent and for our broader communities. So it's really wonderful to see that there is an agreement that that's the way forward, and not just on some of the more usual issues that we would be talking about. So we're not just about health, but much more holistically, and also much more about how we take care of each other and how we take care of ourselves as patient organisations. So that is also something that is very clearly on the agenda for NPON, and we will continue to look at it. So on behalf of the conference, I would like to, Kate, say an unbelievable job by you and your team. Thank you for all of the work that you did to bring this conference together. I think the conversations have been amazing. The presentations, the diversity of challenge for each of us in our leadership roles and in our day-to-day lives has also been a really wonderful discussion to be having with each other. So thank you so much. And on that note, I will let you know that the steering committee will be looking at what are the next steps and we will be in touch. So thank you so much for joining us at the NPON conference.